instances when children with autism spectrum disorder would suddenly display poor behavior, also known as a tantrum or a meltdown. These behaviors generally occur in children with ASD who are unable to identify and manage their emotions. The commonness of emotional regulation in children with ASD increases with age. This is amplified by the onset of puberty that is co-occurring during this phase of development, especially for children who are trying to fit in with same-aged peers in school. As a result, they may display more emotional outbursts, agitation, or aggressive tendencies when they are unable to express their internal state to the people around them. So on today's episode, we will discuss the steps you can take to handle emotional regulation in children with ASD by ensuring that you follow through the steps in this video to mitigate your child's behavior as possible and also help your child to understand their emotions. Children with ASD may face difficulty distinguishing the various emotions that they experience. To start, these children can begin by learning the names of different emotions. Children who go through ABA-VB therapy will learn to identify emotions through pictures. By utilizing their receptive skills, they would be taught to distinguish between the basic emotions first, such as happy, sad, or angry. For example, the therapist may begin with simple photos that only display facial expressions. Once the children are able to display good receptive ability in emotions, the therapist will then move on to teaching them how to expressively name the emotions. Through this example, you are taking steps to help your child identify their emotions. How can you then prepare this activity at home? First, you may start off by creating an emotional chart at home using a whiteboard or a piece of A3 paper. Next, you can add visuals that depict the different levels of emotions that a child may feel, allowing the child to create their own labels for each level. You should then add two columns where one represents the emotional level and the other column should state, "I feel this way because," and leave the column blank for the child to fill in. Subsequently, after preparing a set of emotions in the emotional chart, you may also indicate the different emotions as well, be it positive or negative. You can also create scenarios in the emotional chart and include them in the scenario. For example, what would you feel if your friend snatches your toy away from you? Would you feel angry, happy, or sad? Through necessary prompts and also practice, your child will eventually share their answers, and with so, this will also benefit them from understanding their emotions at a deeper and personal scale. Besides having an emotional chart to help identify your child with their emotions, this exercise also helps your child to identify their emotions to you without having to verbally say it. Ultimately, after following through with these steps, it is also important to get your child to calm down first before helping them to identify their emotions. Here are some coping exercises that you may follow to help calm your child when they are in distress or unsure with their emotions, such as taking deep breaths, counting to 10, talking to a friend, or prompting them to ask for help. For example, some children may appreciate doing muscle relaxation exercises to ease their frustration. Practice these exercises with them before proceeding to explain why they are feeling that way, such as it's okay to feel angry because of a particular event. At ARN, we provide services that cater to your child in helping to regulate their emotions and negative behavioral tendencies. One of the programs that we provide is our one-to-one ABA-VB therapy services for children diagnosed with autism spectrum disorder and other developmental delay. If you have further queries, do contact us through the information on the screen, and do support us by liking this video and subscribing to our channel. If you have any parents that you think would benefit from this video, do share it with them as well. Until next time, bye!